Thank you for joining me today. In this video, I want to go over mood disorders, bipolar, depression. So mood disorders are the most common of all psychiatric illness. It became increasingly common for mood disorders to be treated in the primary care setting. Some clients may present with high symptoms of depression, bipolar, and that require hospitalization. Depression is a distinctive between normal level of sadness and symptoms of underlying brain illness that call major depression disorder. Major depression disorder can be treated in a general and fully with therapeutic interventions. Major depression is predispose the people to serious health illness. So depression can affect somebody's life and function. Depression can be mild and it can be severe. Sadness is disappropriate to the event and sustained over significant time. It significantly impairs normal social function, like the occupation, social. When somebody have a depression, it can affect how their work, their social function like work, school, and other related functions. It significantly impairs normal function. Person can lose appetite, they can lose sleep when they are in the depressive mood. They can lose energy to take care of themselves. It underlines the person function, daily function. So major depression disorder can be described as most common disorder. It has a complexity brain-based illness, persistent mood. It's persistent mood. The disorder degree of sadness that manifests with behavior, it's sadness that manifests with behavior and affect and cognition and somatic symptoms. It has a somatic symptoms. It may have known perceptive events, situation, or concern, but often occur without any precipitating stress identified. So depression may just happen. It may not has a causes. It may not have a contact. It's just a normal disease that can happen to the person, or it may have other factors. So factors that create or lead to depression include genetics, biochemical, environment factors. Depression fall into two categories: psychological and neurological. Psychological, it can be early psychological development issue lay the foundation for the depression and respond in the later in life. First stage of development, in which the child is about to form a relationship, normal relationship, or the second stage of development, child may experience a drama, such separation from the significant object of attachment. Children, when they are younger, if they lose their maybe mother or the object that they care about, that can affect them later in life. Loss may be related to the mother death, illness, lack of available caregiver, unexpected or overwhelming situation, deep of loss, produce consistency of response that leads to separation anxiety, grief, and despair. Critical object loss even proposes the child to respond in a similar way to any other future or significant separation. So some theory, like the loss theory, describes some of the causes of depression. It prescribes that if the child, when they are very young and they developing, if they lost their mother or lost their caregiver, that can affect them later in life when they are adult. Every situation they can see every situation it can remind them of that loss. So that causes depression. Other theory, attachment theory, is also describes how the development lay the foundation for depression respond in later in life, that can accumulate the first stage of the development in which the child forms attachment, forms trust. If any issue happen that stage, it can affect the child when they grown older. If they see that situation, it will trigger depression symptoms. Child experience a loss of significant mothering person. The loss can be real or imaginary, is unexpected and overwhelms the child. If the situation overwhelms the child, it can have long-term effect. The loss may relate to the mother illness or death or lack of emotion of the mother, or new siblings. The child perception losing undivided individual attention from the mother, individualized attention from the mother. So if the child didn't get no attention or little attention, or if they lost a mother, that will program their brain, this is not a safe place, and that can trigger imaginary depression scenario. They will imagine their situation, so that creates the depression. Child may use a defensive mechanism to deal with the conflict created by the desire for love object or anger to the object. Instead of dealing with the anger being expressed outward at the mother figure, the child will turn inward. So the depression is an inward emotion because it is more acceptable and safe to be angry at oneself than to be angry at their mother. When the children are younger, they cannot be control what the mother does, and they cannot be angry with the mother, but they get angry themselves. Anger at oneself is really rational at the child assumption that the loss of the mother was related to something bad that he or she did rather than to the caregiver action. So they blame themselves. The children blame themselves, then they get guilt. They become manifest of the process of dealing with the aggression experience with the loss of the mother attention. Similar to emotion reaction. So then that creates low self-esteem, excessive guilt, inability to cope with anger, self-destruction, impulses. When they are adult, this experience can lead to addiction, it can lead to continued depression, and cognitive theory describes the factors that lead to depression. This theory presented the development experience of the person to respond to stressful life event create the depression manner. So cognitive theory assumes that the people with a tendency to be depressed thinking about the world differently than non-depressed people. That the depressed people are more negative, and they believe that the bad things are going to happen to them because of their own personal shortcoming and inadequate. So they have this imaginary that anything happen will be their fault. So they always blame themselves and feel guilty, and everything that happens that they don't have a control over will affect them. This thinking promotes low self-esteem, believe that the person deserves to be having a bad things happen to them. That promotes the perception about the large world and about them future and themselves. So they blame themselves what they don't have a control, mostly because the event they have stressful events. These people tended to appreciate and the potential consequence in a negative manner. They have a hopeless manner, depressed than other people,